On Chicago's west side, life expectancy can differ by as much as 14 years compared to neighborhoods just a few miles away. Behind those numbers are stories of inequity, of resilience, and of communities determined to close the gap. Westside United was created to do just that, bringing together hospitals, community organizations, businesses, and residents to advance health equity, economic opportunity, and neighborhood vitality across the city's west side. Leading that effort is Ayesha Jaco, CEO of Westside United, a dynamic advocate for community investment, public health, and racial justice. Under her leadership, the organization has focused on creating systems change that does not just treat illness, but transforms the conditions that cause it. From access to healthy food and quality education to economic stability and environmental wellness. Ayesha, welcome to the Newsroom.
Thank you for having me.
Oh, my absolute pleasure. I learned a lot, but I want to learn more. There's a 14-year gap between people living in the west side and the life expectancy of those living downtown. So I am really inspired by you and your organization's work in uplifting this information and the data, as well as trying to minimize that gap. Can you tell me about your organization's mission and what you and your team wake up each day energized to fight for?
Sure. So our big, hairy, audacious goal is rooted in eradicating Chicago's life expectancy gap between the downtown Loop area and 10 West Side communities. It's actually widened, not so much because things got worse, but in terms of how we count communities. So it's related to the difference in census calculations. So it's 20 years. So from the start, we might have been a little bit off in terms of how we thought about the number. So our effort is rooted in anchoring with hospitals in the West Side, including Cook County Health, Rush, Lurie, Sinai, UI Health, who have come together to say collectively they will think about making the West Side a healthier and wealthier environment for residents by thinking about how they hire inclusively, how they spend dollars. If combined, our healthcare partners would be the #1 employer in the state of Illinois. They have massive spend capability, well over the tune of $4 billion. So the idea was, in thinking about the gap, it's more than just access to care. You've got to think about the economic vitality of residents, families. It's a holistic process and picture. So Westside United aims to band together with hospitals and other partners to hire more residents in the West Side, with the trajectory of having family-sustaining wages as part of that ecosystem. We work to support small businesses, where to date we've not only hired over 7,000 West Side residents, but also redirected over $200 million in spend to West Side businesses. So it's about thinking about low-hanging fruit, having institutions that are historically competitors come together around a joint effort to make the West Side better.
Why don't you think most Chicagoans know about this disparity, and most people know about this disparity that exists? And you talked about some of the ways you're looking to address the disparities, but what are some of the roots of the disparity as well?
I think most Chicagoans that live in the West Side and South Side, for that matter, do know.
Sure.
Because they live it.
Yes.
If we were doing this show live in a bus or in a car, driving from downtown into the West Side, there would be a change in the housing stock, a change in the grocery stores that are available, a change in the school ratings. So even for myself, being born and raised in the West Side, we lived it every day as the norm. Institutions like Westside United show that it's not the norm, and it shouldn't be, and that there are collective efforts in place to help work alongside Westsiders too. So in this model, you have hospital partners and community members building these strategies from the ground up. So people are aware. I think having more shared discussion and ownership is what community wants to see from those that can help support and rebuild.
I think shared ownership is really important across the challenges our communities are facing right now. How do you build alignment and make sure the work stays rooted in the communities that you're looking to serve?
So when we started this work, it was born out of Rush University Medical Center's Community Health Needs Assessment in 2016 that really outlined the life expectancy gap across the blue line and green line. And so that set the table for the partners to come together and to decide that they wanted to do something collectively to be responsive. The most important piece following that was talking to the residents, the people that live in the West Side, which is roughly 550,000 people. So we're saying larger than St. Louis, a population larger than Miami, going to have listening sessions to talk to them to see what they thought the problems and the solutions were. So that's baked in our governance. We're 7.5 years old, and we have community members around tables like this with hospital leaders saying where strategies should be born from. A great example is in Garfield Park, where the Garfield Park Right to Wellness Collaborative is the second winner of the Pritzker-Traubert $10 million Chicago Prize. And that is a project born out of the vision of community, a 30-year vision that will now bring a wellness center that includes Erie Family Health, providing primary care. Rush will have a center for well-being. There'll be a cafe, a bank, and this is born out of the visioning of community with the resources of healthcare and multi-sector partners, local philanthropy. So that's what it's going to take, more examples like that.
With those partnerships and then taking in small business investment and workforce development programs, how important are all of these different components, as well as how do you get the buy-in?
Sure. So the buy-in is all about trust building and being transparent and starting from the beginning. When you're looking to build a thing or bring your resources to help someone, they need to tell you what kind of help they need. And that's one thing that I think we got right at the onset. So continuing to do that is important. And then in terms of building the partnerships, once you get trust and it's constant, the building is constant, you can continue to go on a journey around helping to find solutions that community can drive and work alongside philanthropy and other local partners that have a little bit more resources, but not necessarily the vision of what community wants to see. So for us, it's so important to make sure that dialogue is embedded in everything that we do. If we're talking about a maternal child health program, community has to be at the table to make sure we frame that. And so if we want to think about eradicating this gap, and we want to think about the connection to jobs, our research shows that you have to look at median income and increasing that. You've got to address unemployment rates in our target communities. So it is a very layered, complex web that needs to be addressed. But we're finding that with investment, long-term investment, key partnerships, and the voice of community, that it's possible.
It's so possible. What makes you want to do this each and every day and get up each day and keep fighting this fight and doing this work?
I'm born and raised in the West Side, so I have lived a lot of what I'm looking to solve for.
Sure.
So for me, it's a personal mission for my family. When we think about the life expectancy gap, we're noting that people in the Loop will live closer to 88, and people in Garfield Park, where I grew up, it's closer to 63, 64. So in that, I have a burning desire to make sure in the work that I do every day that West Siders at least live to 100. And so that is just a fuel that burns in me to do this work. The personal passion and experience, I think, is the driving force.
It's really inspiring. Are there moments or community stories that have stuck with you that you keep as motivations each day?
Sure. I often tell the story about, personally, my grandmother who was in church 9 days out of the week. Okay, there are only 7, but she was there 9 days religiously, and she unfortunately passed away from cancer 2 weeks after being diagnosed. When we look at the leading causes of the life expectancy gap from a health condition, it's cancer, cardiometabolic disease, homicide, infant mortality, and opioid overdose. So my grandmother was a statistic in the fact that she did not live beyond the ideal life expectancy, but she was in a place of refuge, a community anchor, where if there had been a community health worker there, maybe she would have lived longer and sought care sooner. So part of this model is activating community health workers in churches, in other spaces. And it's about leveraging the genius that our healthcare partners bring with what they're known to deliver, also in acknowledging the harm that they've done through structural racism, historical disinvestment, and pairing that with the genius of our communities and the ability to heal and restore.
Sometimes, and I may be wrong in this, I feel health equity is taken as it could be a passing trend. How do we make sure that addressing these inequities stay on top of the political view and the will of all the people who are currently invested in this?
I would say it takes a systems change approach.
Yeah.
You have to embed it in your mission, in your values. So we saw during George Floyd, unfortunately, and the days of Breonna Taylor and the tragedies that followed, there was this trend around racial justice, equity, companies investing. And if we fast forward to what we're seeing today politically, there's a shift, and maybe it notes that that was a trend for some of those corporations. But what I found to be true, that if our systems and partners have mission alignment that is embedded around addressing structural racism, historical disinvestment, making long-term commitments, because these communities have been disinvested for almost a century. So the reinvestment has to take just as long. So it takes that intentionality from those that have the resources to be in it for the long haul, to share power, and to plan with the people that they want to impact or who are most impacted by these historic disinvestments. And in that, from what I've seen, the people that are willing to be brave, the corporations, the community organizations, and call a thing in terms of why we see disparity, and to help to repair that through resourcing and key partnerships and other measures and methods, they are in it for the long haul. And it is an all hands on deck long-term approach. So it takes that deep commitment.
Thank you. And thank you for your commitment to this work. It was such a pleasure having you here, and thank you for all that you're doing for our communities.
Thank you.
Of course.